Hi, this is my video of me doing my physical assessment on my patient. Number one, inspection. What I'm doing, I'm going to be checking and inspecting my patient's chest, looking at how the chest rises and falls if both sides move equally, and checking the breathing rate and rhythm. This is important because this helps me see if there are any signs of respiratory distress, like labored breathing, use of extra muscles, or blue coloring of the lips or fingertips. That will show lack of oxygen. So she's standing or sitting to the side, and I'm just gonna have her breathe in and out to look for the chest. Breathe in, breathe out, breathe in, breathe out. I'm also checking for nasal flaring or neck muscle use. So breathe in again and breathe out. Next is palpation. What I'm going to be doing, I will place my hands on the back at the level of the lower ribs and ask my patient to take a deep breath. I'm checking that both sides are equally, like that both sides expand equally. This is important because it helps me detect areas where air or fluid might be blocking normal lung expansion or where there's any spots of tenderness. And I was checking for any tenderness, especially if they were coughing or had complaints of coughing. Number 3 is percussion, and by doing percussion, I will be lightly tapping on areas of her back with my fingers, and I'm using my non-dominant hand to put it on first and my right hand on top. By doing this, I'm listening to the sounds, the different sounds that it can make, because normal lungs sound hollow because they're full of air. If I hear like dull sounds, it could mean there's fluid or solid mass. If the sound is extra hollow, it could mean there's too much air trapped inside. And that is why this is important to do. Okay, I'm about to start. Do I have permission to touch you?
Yes.
This is my non-dominant hand going here on different spots, and my right hand here. Unfortunately, I cannot do auscultation because I do not have a stethoscope, but this concludes my physical assessment of the respiratory system, checking for breathing, airways, air in the lungs, ribs, the way the chest moves, nostril inspections as well. Thanks for watching.